Greetings again from Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk to you a little bit this morning about deciduous teeth and how we can use them in our treatment. And this is something some people feel like they can't use these deciduous teeth, but you can. I've been doing it for years, and in early treatment, go ahead and band the deciduous teeth just like any other tooth and use it. And if it's resorbed away, that's fine. Actually, you can take the deciduous tooth and move it over, or you move several of them over, and that moves the permanent tooth that's underneath there. The bud of the permanent teeth will usually follow the crown of the deciduous tooth as it moves, like this. Now, if you wait till the tooth's about ready to fall out, that might not do the same thing, but I can move and expand an arch when it's early by using the deciduous teeth, and that expands the permanent teeth that are underneath there. So I recommend using these teeth like this, and I've got a little case here. It's just going to take a little while to show this, and we'll get in there, and let me see, I got to get this going. This is a a deciduous tooth that has been removed, and we just had it in treatment, and I cleaned it up. Let's just let you see. There's none of the enamel is eaten away at all, but the permanent tooth, the cells that go in front, go up inside the tooth and eat away the dental part of the tooth, and the tooth will be sitting there over this bud. If you move it around, it has an effect of moving the bud of the permanent tooth, or moving the crown part that's up there close to it. Anyway, we'll go ahead and I'll show you a little bit of that. Now, a lot of times you need to get in early and do something, and you've got a whole bunch of deciduous teeth, and so this is what's happening in this case. We've got deciduous teeth down here. We have looks like 3 deciduous teeth up here, and the same thing going over on this side, and so we have to come in, and the upper is given a problem. Like these cuspids are coming in on top of permanent laterals that are right in here, and the same thing's happening over on this other side. So I want to get in and get this cleared up and get it to where the teeth are coming into the place that we want them to come into. Now, here we've removed these deciduous teeth, and the bicuspids, this bicuspid is probably going to give us a little problem there. Here we come down with this one. This is resorbing good, and we've got this gap open, and I put the spring in here, see, to keep this open for this tooth to drop on into this spot. Same thing over here. We've got a little spring pressure on this, and we're going to bring this one in here. Then if this doesn't show up to come in here good, we'll go ahead and take that tooth out and let the permanent tooth come in there. But we've got the deciduous teeth bracketed all in here, and we're only working on the upper arch during this period of time, and we'll come in and do the second phase of treatment after these teeth get in further along. We have just a few deciduous teeth left or something. We'll start the second phase of treatment, but we use these deciduous teeth, and you can see how here. All right, here's 1984, and we put we've got some roots on these deciduous teeth. Are getting pretty pretty poor. These are about ready. Now it's about ready to go right there. Now we've got this permanent cuspid hitting this lateral, but we're holding this space open for it, and it'll come on down in there, and this will come on down in here, right here. And here we may have to help out over here to get that tooth to come in. We're just waiting and see what's happening here. So we just put braces on the upper. The lower is doing good. Now these two deciduous molars will go, and we'll have plenty of room for them to come in, and we're in a pretty good class 1 relationship here. Let me erase that. Now let's go to the next. Now the rest of this will just be on the actual doing of the work on the teeth. So we put a arch wire in there, and I've even got looks like a rectangular wire, maybe that's an 018 round wire, and we've got space, and we showed where we were waiting on that tooth to come in, and this tooth to come in here. These two cuspids will come into that space like that, and that's, this is in 1984 when we were doing this, and here we're coming along pretty good. We've got an expansion in the arch right in here. You see this is pushing on the arch wire. It's increasing the space in here, and we're locating the gain of space in this area right here. Now if you had problems with the roots up here, you could come in here and go up, go like this, and come that, and you can change the root position of this tooth if it has to accommodate a cuspid or something that's trying to get down here, and you want to get this tooth out of the way so you can get it over here, and then you can take that away, and the root will come back over here and push the cuspid crown and straighten it up. So you can push it developing teeth up in here by how you run this root of the deciduous lateral, if that's the one. If it's over here, you do the same thing. So you can move these teeth around like that, and you can put torque on them if you really want to get into a rectangular wire. I'm just going to show you several things that you can do and use these deciduous teeth to do that. All right, here on this side we just got the gap open for the permanent cuspid to come through, and we're using two deciduous teeth. They're space maintainers, and they're excellent. And I don't know why some people teach that you can't use deciduous teeth, and that's false. You can use them, and I wanted to pass that on. All right, we've got ample space in here for these teeth to come through, and then this is 3 of 84, and on the bottom we have we still have several deciduous teeth in the bottom arch now, and so we'll probably be losing some of these pretty quick. So it's 3 of 84. Here we are, and 7 of 84, and we've still got the teeth going, but nothing has happened significantly here. That spring is way off from there. Let's see, lost one of those deciduous teeth, and here we're coming on, and the upper arch, these teeth are getting very, as far as root structure, they have very little. Here is the bicuspid crown coming in, and it can't come in. It hasn't it can't eat the deciduous tooth enamel, but it can eat the dentinal structure out from under it almost complete. I've had them, they come out and look like an enamel shell with virtually all the dentin structure in the deciduous tooth eaten away. And this tooth is coming in there at that point. We're still in this first phase, and we're using deciduous teeth. I guess you're tired of hearing me say that, but now these two teeth that I remember when that person came in, those teeth were so loose right here. I just reached down and flipped them up like that. Then you'll take them off. And now we've got a cuspid, and we've got a first bi, and we've got a second bicuspid coming in this area. We want to take those teeth out at this point, get them out of the way, and you'll put a step-up arch in there. And let's see, here is one of the teeth I took out, and you can clean it up. And a lot of times we go to the kids and with the bracket on them, let them take it home with them and show it to their friends. Now here you come in, you've got a long distance. You've got 3 teeth that are in here to come into this space, and we don't want to lose any of it. So you can come up and just go across here and come down by your molar and back in excuse back into that molar. And if that, you have to be very careful not to poke this out of the tissue. I put a little plastic tubing on it if you want to, but we rarely ever do that. Now, this step-up arch or a step down, you can do them, we call them like that, or unique arch wires, and they do a good job at the thing you're getting them to do. I'm going to make this just a plain page here and show you. Like on a step-up arch, you come in here and you come up and you go across and you step it down here, and this would be, your molar tooth would be in here somewhere, and you step down right, well, I should have thrown it here, you step down right in front of the tube that's going into the molar tooth right there, and this would be right in front of the bracket over here on a, say, we're going to draw on here. We'd have a bicuspid tooth over here. Now, step-up arch is unique in that if you want to expand the arch on the step-up arch like that, then you come in and your arch is like this, and you're against the tube here, against the tube here, and against it over here. If you push the leg of this out in this direction, and you'll have to squeeze it together to get it in there, and when you do, it puts a bend in the arch like that. So as you're pushing the crown this way, the arch wire will make the root go the same direction. So if you're closing up, the arch wire makes the root go where the crown is going on this type of arch wire. So it's real neat to learn how to use one of those, and it does a good job with it. Now let's see. The other side is still clear, and this is letting those teeth come in the arch. When they get in good, you can change that arch wire and let those come down. And now you're just about ready to do the second phase of the orthodontic treatment. Sometimes we'll quit at this point and wear a retainer for a little while, and then we'll come back and finish the case for the second phase. Now here the lower arch now is completely banded, second molars and everything, and we'll see it come in. Now this is where we stopped, and I'm going to close out. That's just the primary thing here was using these deciduous teeth. don't be afraid to use them. And if they come out during treatment, you just raise the arch wire and hold the gap open for the permanent tooth that's under there. And the deciduous teeth help you do things early, where you've got cuspids coming out of position. You can do a lot of things early by using the deciduous teeth. So I hope you get something from this, and I'm going to hush up and say goodbye for the time being, and hope to see you again. And I hope you'll join our group and subscribe to our channel, and we'll say goodbye here.